Hi, my name is Peter Goadsby. I'm Professor of Neurology at King's College London. I'm pleased to present to you a series of videos that raise awareness around migraine. Migraine is a common neurologic disease worldwide that is highly disabling and impacts the quality of life for people with this condition and those around them. These videos are conversations between physicians and people with migraine, where we'll hear first-hand experiences of people living with this condition and gain insights into the debilitating nature of migraine. These videos will cover migraine throughout a woman's life, stigma and attitudes towards migraine, untreated or underdiagnosed and misdiagnosed patients, migraine in the workplace, migraine throughout a woman's life.
Hello, I'm Dr. Dawn Buse, a clinical professor of neurology at Albert Einstein College of Medicine and licensed psychologist. I'm also a researcher in migraine, other headache, and other chronic pain conditions. I'm so pleased and honored to be joined today by Shoshana Lipson. I'm going to let Shoshana introduce herself. Welcome, Shoshana.
My name is Shoshana Lipson. I'm a patient advocate and the executive director of Hope in Pain and Migraine Meanderings.
Welcome, Shoshana. So, Shoshana, you have very graciously agreed to share your life experience as a person living with migraine, and you've had migraine most of your whole life. And you're going to walk us through what that's been like in terms of impact on all aspects of your life, as well as how you're doing now. So please start by telling us your first experiences with migraine or severe headache.
Some of my earliest experiences in childhood are of having migraine, which really means I don't actually know how young I was when they began, but I know for sure I was having very severe attacks by the age of 6 or 7. And my memories are just of having to go to my bedroom where it was dark, lie down, my parents not knowing what to do. Somehow they seemed to know it was migraine. I don't know if that was because they'd read about it somewhere or because a doctor had told them, but they told me, yes, you have migraine. And they kept trying old wives' tricks, your lavender and things like that. Always made me worse because those are some of my triggers. But definitely, my earliest memories are of having these attacks where the pain was excruciating and nobody seemed to be able to stop it.
Does that mean that you don't have any relatives with migraine that you know of?
So that's a really good question. And many times I've asked my parents this. So neither my mother nor my father have migraine for sure. But both of them say that their mothers had headaches, quote unquote, where they would have to go and lie down in a dark room. So my guess is that I had two grandmothers, both of whom had migraine, but it skipped a generation, which is interesting.
So migraine does have a strong genetic predisposition. It does tend to run in families. And often when we're talking about our family before us who had migraine, it'll be described just like you talked about it. Maybe a grandmother who had a sick headache, maybe meaning she was nauseous or she vomited with migraine. And they'll also talk often about lying down in a cool, dark place, getting away from light and noise. The World Health Organization, in fact, has confirmed that migraine is one of the top 3 most disabling diseases on the planet. And that's from the recent World Health Organization Global Burden of Disease study. In fact, in women aged 15 to 49, it is the either most disabling or second most disabling disease on the planet. Most disabling neurologic disease, second most disabling disease worldwide. So migraine affects 1 billion people globally. And the experience you're talking about, while it's incredibly powerful when one person tells their story, when we do our research around the world, in fact, the World Health Organization has conducted the Global Burden of Disease study, migraine is disabling pretty much around the world, across time, across age, across gender. It is a disabling disease. And so your story, it sounds like at the time you might have been the only one you knew with migraine, yet it's amplified by literally 1 billion people who live with migraine at any time globally. And in fact, the World Health Organization has acknowledged that migraine is one of the leading top 2 or 3 causes of disability worldwide. Did you have any friends who had migraine? Did you talk about migraine to friends? Did you talk to school teachers? Did anyone else know about migraine?
They really didn't. I don't remember ever talking to my friends about migraine. To be honest, that's kind of the story of my life up until about 10 years ago, that I just didn't really talk to people about what was going on, how severe it was, how it impacted me. The few times that I do remember later on in my life talking to people about it, no one really understood. And so I learned to not talk about it, because if people don't understand, it just makes you feel sicker, more frustrated, and kind of isolated as well. And so I really just didn't talk about it that much when I was younger. Now, in terms of my friends, I don't remember any of them having migraine. Obviously, looking at statistics, some of them have to have had migraine. There's no way they didn't. But none of my friends certainly had these debilitating attacks that completely took them out at the knees. That just I didn't see that in anybody that I knew at all. So my presumption is that some of them obviously had migraine, but the attacks weren't as severe. They were just able to keep on going and cover it up.
And it's interesting that you did not know any friends with migraine, because chances are there was a fair percentage of your class who would have migraine. In children, we think about 5-6% of younger children have migraine, but after menses, after puberty hits, we see those rates really rise up until young women. About 18% of young adult women have migraine, and about 6% of adult men. So chances are you were surrounded by people who did have migraine, even if it hadn't expressed yet, or they didn't realize it yet, or it may not have been as disabling, painful, and debilitating as your attacks were. One element of life with migraine that we've been studying quite a bit recently is the stigma. And stigma is feelings of guilt, embarrassment, or shame, feeling different, having any type of medical or physical condition, in this case migraine, that people might judge you by, or one might judge themselves by. So Shoshana, when you talk about your experience as a young woman or a teenager with migraine, it sounds like you felt a little bit of stigma. You mentioned that you kind of tried to hide it or downplay it, or you didn't let others know. Can you tell us more about the stigma of migraine that you felt as a young person, or that you felt at any time in your life?
Absolutely. I would say that the first time I really experienced what I would call stigma was when I was 10, from the school nurse telling me to go out and take a brisk walk, and that would make me feel better, even though my head felt like it was about to explode. And we know that activity during a migraine attack almost invariably makes the attack worse. And so that was why I first realized that people didn't understand what was going on. But not only that, they didn't necessarily want to understand. And so that kind of conditioned me to stop talking about it, because why would I talk about it if people were going to tell me to do things that would make it worse? It was just very frustrating to go through that, and also very hurtful, because I was dealing with feeling different than other people. You know, I had to miss going to events that my friends went to. I couldn't wear perfume. I couldn't be around my friends if they wore certain types of perfume. I couldn't be out in bright light too much. And it was just very hard because I felt different. Also, I really loved this one. So I would say that the first time I really experienced stigma, as I would call it, was when I was 10, from my school nurse, who would tell me during a migraine attack that I would feel better if I just went out for a brisk walk and got some fresh air, and that beautiful, brisk English fresh air. Of course, that never made me feel better. It always made it worse. I needed to lie down in a dark place where there was no noise, no sound of any kind, no lights, and definitely no movement. And so that kind of conditioned me to stop talking about migraine and what I was going through. Because when I did talk about it, not only did people generally not understand, but it felt like they didn't want to understand either, almost like it was my fault, because didn't I just realize all I had to do was go and take a walk and I would feel better, or be less stressed and I was better? And so I stopped talking to people about it and started to internalize. And so I would say by my teens, there was a lot of self-stigma. What was wrong with me? Why couldn't I stop this? Was this really as bad as I was making out? I couldn't wear perfume. I couldn't be around people who wore a lot of perfume at that time. And I couldn't be out of bright light. I wasn't able to listen to music like all my friends were. All the things that you normally do in your later childhood and adolescent years, I just couldn't do. And so there was a lot of internal stigma going on, and then I would hide it around other people.
Thank you so much for sharing this, Shoshana. I know that people watching and listening to this right now may be experiencing the same thing. Stigma with migraine is very common, both for young people with migraine as well as people at any age. It happens with friends and family and in the workplace and at school. It happens everywhere. So thank you so much, because I think someone listening might really connect to what you said and say, oh, I feel that too. Of course, adolescence is a time of great change, including physical changes, going through puberty and the start of menses for women. Shoshana, did you find any relationship between migraine attacks and your menstrual cycle?
As I got older, I definitely started to notice a relationship. Obviously, my attacks started well before puberty. But during puberty, they would always be much worse around my cycle. So generally, immediately after my cycle started, I would have a worse attack. It would last longer, be more resistant to treatment, sometimes going many days and even, going on over a week sometimes. So there was definitely a relationship with my cycle as I started to get older.
Well, that is a very common experience for women. Migraine attacks may be quite tied to the menstrual cycle, and certainly something worth talking to your doctor about. What advice do you have for a young person with migraine, maybe their family, maybe school administrators or teachers? What do you wish people would know and could do today to help?
Absolutely. I would say that it's really important to learn all you possibly can about migraine. Right? We know that this is a complex neurological disease, that it's nobody's fault that they have it. And I wish that I had known more about this disease when I was a child. So 2 of my sons had migraine. By the time they were 9, they were diagnosed. And I was determined to have them to have a different experience than I had. So that involved me going to their teachers, talking about accommodations, coming up with 504 plans, all those things that I didn't have. I went out and I tried to get for my sons. And I think that would be the best recommendation I have for people who are experiencing migraine in their teenage years, or the parents of a child with migraine, is to be proactive about it, and to go and talk to the teachers, to request accommodations, even if it's just something like wearing a pair of sunglasses in a room, or during phys ed, not being able to be very active or even active at all during an attack, having treatments at school with the school nurse. So those would be some of the things that I think are really important to address when you're a teenager or you're a parent of a child with migraine.
Shoshana, you said a really key word, accommodations. Accommodations can be anything that helps anyone with a medical, a physical, a psychological challenge to do better at school or in the workplace. So you have a right to do the best you can in both of those places with reasonable accommodations. And accommodations can run the gamut of what makes someone feel better. If someone has extreme sensitivity to light, they may like dim light or the lights off. They may like to wear therapeutic glasses, which filter out some of the painful light. And these accommodations can range far and wide. In school, they may have to do with having air conditioning, having more time for tests, having tutoring, being able to use a computer to take notes, so many things. And in each individual setting, the person working on accommodations will personalize them to that person. And the patient may need to talk to a doctor to get a doctor's note, but you don't have to do that, but it may help. So thank you for mentioning accommodations, because no one needs to struggle the way that you unfortunately did. So thank you for mentioning that. That's really important. Shoshana, what was your life like after you finished university and kind of launched the rest of your life?
So after university, my attacks continued to be more frequent and more severe. By this time, I also had a lot of neck pain. I had something going on with my neck, and the neck pain would trigger my migraine attacks, but the migraine attacks would also trigger the neck pain. And it was getting increasingly hard to manage the two. And so that kind of brought me to age 23 when I saw my first headache specialist. And that was in London. I don't remember a whole lot about the first time I saw that doctor, but what I do remember is that there was no elevator in that location. That I remember there was. Anyway, but there was a lot of stairs. And I remember looking at those stairs and thinking, wow, if I have to climb those stairs, that could trigger a migraine attack. And so there was constantly thoughts like that going through. Well, if I do this, that could happen. If I try this, I'm going to get sick and there's going to be consequences. So I was already starting to weigh the cost of activities that I was doing against the negative that could potentially happen from that. And in the many cases, that was appropriate. You know, I knew that things could trigger attacks, but on the other hand, there was a lot of fear coming to that as well. That isn't necessarily as healthy. And of course, I had nobody to help walk me through that because there was no internet. I didn't know anybody else still who had migraine. And so I was trying to figure this out by myself. But when I saw that headache specialist, that was when I started on preventive medications, which I hadn't even heard of until then. Obviously, they weren't migraine specific. We were borrowing them from other disease spaces, but it was definitely, that was the start of working through options to try to reduce the number of attacks that I had.
Well, we may think of a migraine attack as just the headache. In fact, it has multiple phases and potentially many symptoms that go beyond headache that can be quite disabling. So many people will notice a pre-headache phase, which could be a whole day or even 2 days. During that phase, you may experience things like neck pain. You may have more sensitivity to light and sounds and odors, even though that may happen all the time. You may notice that difficulty with thinking clearly, remembering things, finding words, making decisions, those cognitive impairments. You may notice fatigue and other symptoms. And that's kind of pre-headache. And you may have heard of the words prodrome or premonitory, and that's that pre-headache phase. And then some people will have aura sometimes. And aura lasts between 5 and 60 minutes, and it has to do with unusual sensory experiences. People may lose part of their vision. They may see bright flashing lights or ziggity lines. They may have trouble forming words. They may have a tingliness on part of their body. They may smell things that aren't there, all sorts of unusual sensory things, and it can be quite scary when you don't know what that is. In fact, people will often be so scared they might even go to the emergency department the first time this happens, when they lose part of their field of vision or they can't feel part of their body. That will happen to some people some of the time. And then we go on to the headache phase, which has that very painful headache from a moderate to severe pain, as well as some other cardinal symptoms like extreme sensitivity to light, to sounds, to odors or smells, as well as you may be nauseous. You may or may not even throw up. And as you talked about climbing stairs being painful, that often gets worse with physical movement. So people often really just want to lie down in a dark, quiet place. And if you can fall asleep, that is terrific. Sleep is a good thing. Sleep is our friend during a migraine attack. And then even after that headache is over, there's the post-headache phase, the postdrome, that has its own set of symptoms. You may feel fatigued or wiped out. You may still have those cognitive impairments. You may not be thinking clearly or thinking as sharp or as quickly as you'd like to. You may still feel sensitive to lights and sounds and noises, just kind of a tired, wiped out, not feeling yourself phase. So when you put all that together, a migraine attack can be quite long, quite disabling, and have a whole range of symptoms that come and go with any particular attack. In addition, you may have some of these symptoms in between attacks as well. So Shoshana, you talked about several of these symptoms being problematic for you both during attacks, and it sounds like you had some of these between attacks as well. It's well established that migraine can negatively impact all aspects of life. We know that from large studies in the US, Europe, and around the world, that migraine can impact the biggest decisions and the smallest daily life activities. And one of the areas that migraine can negatively impact, of course, is dating, marriage, and marital relationships. Shoshana, tell us about your life with migraine in dating and getting married.
Sure. So when I was dating, first of all, when I was still living in the UK, and then when I came out to the US, there was constantly this thought in my head of how much do I tell the person I'm dating? When do I tell them that I have migraine? And I also had other health challenges as well. So do I just hide it all until I see if we get serious? Obviously, you often can't hide a migraine attack, and I couldn't hide mine, but how much did I really want to tell them? So that had a pretty big impact. And I would say probably even more so because I was limited on what I could do. So it wasn't just, do I have an attack or not? It was more, do I tell him that his cologne is triggering for me and will start an attack? Do I tell him I can't go to a loud concert, or I can't go out in the sun where it's hot and it's also humid? So there was constantly this concern of how much do I tell them? Will it be really off-putting if I just say, by the way, I have migraine and I can't go to movie theaters, I can't go out in the sun, you can't wear cologne, et cetera, et cetera. It just seems like a lot of I can'ts. And then, of course, once you're married, you can't hide that anymore. And so I moved out to the US. I got married shortly after. I was about 26 years old. And I know that my husband at that time, he knew that I had migraine, but he didn't know how bad it was. I think I didn't even realize how bad it was because it was just slowly getting worse. It's almost, for me, like if you put a frog into a pot of cold water and slowly heat that water, it doesn't realize when it's got to the critical point. And I think that's really what my migraine attacks were like as well. They were just slowly, gradually getting worse and impacting more and more of my life. And it was definitely challenging, not as challenging as it was later once we started a family, which I know we're going to talk about, but it was still challenging because it impacted what we could do. And of course, there was always that caveat, I'd love to do this, but if I have an attack, we may not be able to do that. And so it just adds an extra dimension of challenge into your relationships. And definitely that was true for me. It added that challenge.
For many women, migraine attacks are related to hormones and changes in hormones especially. So pregnancy, pre-pregnancy planning, and postpartum breastfeeding can be times of dramatic changes in migraine attacks. Shoshana, what was that period of your life like for you?
Some of my earliest memories, or my most clear memories at that time, are of looking at my children watching me as I was being carted off to the emergency room. And of course, all the guilt about, am I traumatizing my children? And what are they going to remember about these early years? Because I'm always either in bed in pain or I'm going to the hospital in pain. And so, yeah, I have a lot of mother guilt. I would say, as mothers, of course, we always have guilt. But when you also have a chronic disease, that guilt just amplifies. So besides the guilt, I think just being available for my children was a challenge. Looking back, obviously, I know that I was a good mom, and, I told them that I loved them all the time, but I still feel guilty for the things that I couldn't do with them. And then for all the things that they saw me go through. And then for my oldest two, when they turned 9, each of them, they both started having migraine attacks as well. And so the positive about that was that I recognized it immediately. I remember my oldest son saying, "Mommy, flashy lights, flashy lights." And I could still picture him in his bed saying, "Flashy lights, flashy lights." There was no pain. And I had no clue about genetics at that point in time. I didn't know that this was, could be inherited or passed down by genes, but I knew my son had migraine. And everything went downhill for him from that point in terms of migraine. And then for my middle son. And so not only now feeling guilty about the fact that I'm missing time with my children, but now I feel guilty that 2 of my sons have migraine. and they're having to go through what I was going through. And as hard as it is to go through the agony of a very, very severe migraine attack, that's nowhere near as hard as watching your children go through the agony of a severe migraine attack. So a lot of heartbreak and pain and misplaced guilt, because obviously it wasn't my fault that I had migraine. But at that point, that's where I started seeing a doctor more frequently. And we started brainstorming to try to figure out how to keep me out of the hospital. I had to learn how to give myself injections. I had to learn how to stop when I got sick. And eventually I actually ended up admitted for 3 weeks to a headache center just to try to get my migraine under control. And so again, I'm leaving my 3 young children. They were all under 8 years old at that time when I went to the hospital. And it's just heartbreaking to go through that yourself, to see your marriage go through that, because definitely the impact on my marriage was huge. And then to watch my children watching me be sick to that extent, and knowing that they were afraid and they were worried for their mommy and what was going on. So it was really challenging.
It sounds really, really awful and so stressful and sad as a mom. I think all the moms watching and all the parents watching can understand that feeling of, as you said, not only is it awful going through a migraine attack yourself, but watching your child suffer is really, really excruciating. What advice do you have for parents of children with migraine?
So that's a great question. And I've written a couple of blogs about this. I've actually interviewed, quote unquote, 2 of my sons and asked them, what was it like watching me go through that in those early years? I would say the best advice I could give would be to talk to your children. They don't need to know every single little detail, but they do need to know that when I got a migraine, that it wasn't my fault, that I still loved them. It wasn't their fault. It wasn't that I didn't want to spend time with them, but I wasn't able to. And so I encourage people to, first of all, let go of the guilt, because it's not your fault if you have migraine. I would say, secondly, talk to your children and explain migraine to them in a way that is appropriate for their age, obviously, and then get creative. So you may not be able to go to the beach with them, but maybe you can, do s'mores in the fire, if you have a fireplace, or you can play family games. If your migraine attack is so severe, you have to go to bed and be in a quiet place, there's really not much you can do. But if it's not that severe, maybe you can lie on a couch while your children are playing a game. So at least you're there and present with them. So I had to get very creative. And then ultimately, they had to do more than I think most children their age nowadays would normally do. So they had to learn to do their own laundry. They learned to cook. They learned to clean. None of these things are bad. I had 3 sons, so it was great for them to actually learn these skills. But again, I was very guilty that my children had to do this as my attacks became more and more frequent. And then, my marriage failed. And so I was a single mother doing this, and they really had to just kind of step up to the plate and do things that were hard for me to watch them doing, because I wanted to be there and be present. But I think that the advice would be creative, talk to them, and realize you're not destroying your children because you have a migraine attack. And there are worse things in life than your children having to do more chores than you might otherwise want to give them. These are not the worst of things. And then set up, if you can, people who can help you. So if your children have to get to a school event and you can't drive, hopefully as a family member, or do you have a friend who can come and pick them up and take them, so it has the least disruption to their life as possible. But realizing sometimes that's not possible, and they will miss things the same as you.
Absolutely. You mentioned the mom guilt, and I'm sure so many of us parents can empathize with that feeling. But like you said, I don't see you as someone who should feel guilty. I see you as being a super mom. You were a single mom living with a chronic illness with children who also had a chronic illness. And what did you do? You got creative, you accepted help, and you created very resilient knowledgeable, capable children, which is only a gift for them. I think you should take a moment and pat yourself on the back. And I think everyone watching and listening should also pat themselves on the back.
Definitely.
Cares about caring for their children and is doing their best. So all those parents out there need to take a moment and let go of any parent guilt and just, know that you're doing your best and your children are resilient and they will get through this.
Right. And often the children of parents who have a chronic disease, they end up being incredibly compassionate, empathetic. They understand that life isn't always a bed of roses, but it can still be great. They learn how to pivot, how to adjust to things. And so these are actually great skills for your children to have. And it's good to focus on them rather than focusing on the guilt. But of course, as a mother, the guilt always kind of finds a way to sneak back in. But I'm telling you, if you're a parent who has children and you have migraine attacks, it's so important to let go of the guilt. Connect with other people who have migraine and talk to them about what you're going through. And they will also tell you that. And that's so important to have people telling you it's okay. Your children are going to be okay. There are times you have to take care of yourself and your children will be all right.
So let's talk about the next life phase. Let's talk about the perimenopausal and menopausal period. The perimenopausal period can last up to about 10 years, and it's a time when hormones are changing, cycles are changing. And then menopause is the time defined a year after cycles have stopped. So we know from research that these can be really challenging times for women living with migraine. We can see an increase in attacks, increase in severity or duration or symptomatology, and things kind of fluctuate pretty wildly for up to a decade or more until those hormones really settle down in menopause. Shoshana, what has this time period been like for you?
It's been a challenging time period. Ironically, my perimenopausal time kind of coincided with when I got remarried. Ironically, I remember clearly the day that I actually got engaged. That evening, I was just bent up, double over in the bathroom over the toilet because I had a really, really severe attack. It was the first time that my fiance had ever seen me have a migraine attack. He had heard what it was like, but had not actually seen me. I was still at the phase where I was trying to hide everything. And so that was the beginning of this escalation in our first years of this new marriage, where my attacks became completely out of control, super frequent. I had to stop taking the acute medication that I'd been using for a decade because I got side effects from it. And so that cut out a whole class of medications, in fact, 2 whole classes of medications. And so trying to stop an attack when you don't have a normal acute treatment, to do that was really hard for me, especially when it happened at the same time as I was getting more and more attacks. So now, instead of an attack being a few hours of nightmare, now they became day after day after day. It was no longer that 4 to 72 hour thing. I could have an attack that lasted a week, 2 weeks. I became well into the chronic migraine number of days per month. And it was really hard because nothing that I did seemed to make any difference. Again, I still had doctors that were great, but nothing preventive was really making a difference. Nothing acute was really stopping it without going on to really strong medication to try to handle it. And honestly, I was just wondering, am I ever going to get out of this? Is perimenopause ever going to end? Of course it does end. And it did end for me. Unfortunately, my migraine attacks did not stop. So I'm not one of those lucky ones who, as you go into menopause, the migraine attacks completely go away. Have they become less frequent? Yes, especially some months. Some months they're really bad. And so that, I think, in itself was a big transition psychologically for me, because throughout my life I've been thinking, well, maybe when this happens, I won't have as many migraine attacks. Or maybe when this happens, and this was kind of the last phase where I thought, well, maybe when I go into menopause, I won't have migraine attacks anymore, or they'll only be once a month or twice a month. And that just wasn't true. So I've been left with, wow, is this my life now? Now I'm in menopause. Is this it? Is this as good as it's going to get? And that's after 10 years of having almost daily migraine attacks that are just out of control, and holding on to hope that, wow, when I get through this, it's going to be so much better. And then coming to the realization that this wasn't the last hurrah, as it were. This was just going into a new phase, and the attacks would change, but I would still be having them. And now, of course, as I age, other health problems as well, like high blood pressure, and I have an autoimmune disease, so that has been getting worse, and extreme fatigue as well. So the perimenopause time of my life was very, very challenging, and has just moved into another challenging time, unfortunately. It's like my migraine attacks have presented differently in each phase of my life. They've never gone away. And so this is just them presenting differently now.
So Shoshana, as you mentioned, for some women with migraine will become much less frequent or mostly stop altogether in the years after menopause is complete. But that's not true for all women, and I'm sorry that hasn't been the case for you. You also mentioned other kind of medical issues that happen at different ages, and you mentioned high blood pressure and other kind of cardiovascular issues. And as we all age and our bodies change, doctors will need to reevaluate medications because there are some that are appropriate at different life phases. Can you tell us how life with migraine has changed?
Yes, I would say now what's stayed the same is it continues to impact every part of my life. So it affects my relationship with my children, who are now young adults, with my husband, with my friends, with people I work with. But how it's changed, I would say mainly for me, is I have to be more careful about the treatment options that I use, because some are now contraindicated with other health conditions. Some are contraindicated with the medications I take for those other health conditions. So I personally feel like I have to keep track of all my conditions and all my medications, and I'm constantly monitoring potential side effects or interactions from those medications. In many ways, I've had to become my doctor. Not that I don't have great doctors, because I do, but they each focus on their own little area, and I'm here looking at it as the whole big picture. I think the biggest thing is trying to decide what's most important. What is the fire that is burning most ferociously that I need to put out? What is hurting the most? And it almost always comes down to migraine, because if I have a severe migraine attack, everything else stops. So there's no point taking care of everything else and letting my migraine go to pot, as it were, because the migraine attack will stop my life. And so that is always the number one priority for me. And that can be challenging when talking to doctors about it, who are dealing with, gastroenterologists or cardiologists, and they all want to have their say about what you should do and what you can take. And I understand that, but it always comes down to, if I can't take this migraine medication, I can't use this device, then I don't have a life. So it has to be migraine first. It's always migraine first. On the positive side, I would say that my perspective towards migraine has changed. So having pushed my body too far and seen the consequences of that, I know the importance of extreme self-care. I love that phrase, extreme self-care, which I came across a few years ago. Creatively making wise choices, not always easy choices. Accepting this is my life. I have migraine. I may not be able to go to an event I wanted to go to. Everything I do has that caveat to it. But on the other hand, also holding on to hope, refusing to give up. So I accept this is what I have right now, but I don't accept this is going to be what it is for the rest of my life. And so I spend a lot more time on education and talking to doctors and talking to researchers and reading articles and learning everything I possibly can about this disease. And of course, tracking anything that's new in the clinical pipeline, which I'm always avidly doing. Is where is it at right now? Is it phase 1? Is it phase 2? When is it going to go into phase 3? And then how many years before that comes to market? And will this be the one that really makes a difference in my life? And now all 3 of my sons have migraines. So my youngest one also started getting migraine. And so on top of trying to juggle my own health as well, helping them learn to talk to their doctors, learn how to advocate for themselves, learn to be wise in their choices at a much younger age than I was. And so all those things have really changed in the last few years for me.
Shoshana, you mentioned the phrase extreme self-care. Tell me more about that. What does that entail, and how does it help you live as best as you can, as well as you can with migraine?
Absolutely. So I would say different aspects. So for myself personally now, when I get a migraine attack, unless I'm at a conference or somewhere that I'm going to push through as hard as I can, when I get a migraine attack, I stop. So in the past, I would take an acute medication or use a device, and it would bring the migraine under control, not necessarily stop it. And I would just keep on going because I felt kind of okay. Now I realize that's not a smart thing to do. So part of extreme self-care for me means if a migraine attack is bad enough that I have to treat it with something prescription, then that also means I'm going to stop. I'm going to go into my bedroom. If it's really bad, I won't do anything. If it's not super, super bad, I may be reading my Kindle, which I've also adjusted in terms of light and brightness and everything. So I look at every aspect of my life. I would say it means not saying yes to as many opportunities. That's also extreme self-care, knowing just because I can do something doesn't mean that I should do something. So constantly monitoring what is wise for me to do when it comes to relationships with friends. Part of extreme self-care is being honest with them and saying, hey, when you're around me, please, would you mind not wearing cologne, not wearing perfume? Please don't wear anything scented. If you come to my house, really nothing scented can be in my house. And that's hard. It's hard to ask your friends for accommodations, but it's also been somewhat eye-opening to me, because the people who are really your friends, they're going to want to help and they're going to want to learn as well. And I would say with my husband in my marriage, I have an amazing husband. He's incredibly understanding about migraine, and it really doesn't seem to add a lot of stress into our marriage. It does for me because I feel guilty. But for him, he is just an amazing caregiver. And I think what we've had to do is say, okay, we may not be able to go to a movie theater, but guess what? We can get the candy and we can get the popcorn and we can, purchase that movie on our TV and stream it and just have a night in where honestly we're more comfortable anyway, and we get to eat what we want and stop if we want. I can't do a beach day when my kids come to visit, that we can play board games and laugh. And so for a lot of it is about treasuring memories and creating memories, new ones, and just realizing what my boundaries are, realizing the triggers that I need to avoid as much as possible, and then finding other things to do that would still keep creating those memories. I would say finally in work, I'm not able to work full time. I'm not able to hold down a job outside the home because my attacks are still so frequent and still so severe. But I got involved in patient advocacy. So just that ability to take something that is terrible and make it into something that could be for good. Like put your pain to purpose comes to mind. That's been huge because it takes my eyes off myself and onto other people, and it's good to take care of yourself, but not always to be thinking constantly, I feel really sick. I'm just going to stay in bed. And then you really lose your life. And then with that come all the psychological consequences, depression, the anxiety, isolation, the loneliness. And so I've been learning how to balance all that, how to connect with the people I need, when I really need to get out of bed and when I just need to stay in bed and say, okay, I'm not moving until this attack is over. So I've become a lot more wise in how I manage this disease. Of course, it's easier when you don't have young children around. But as a driven person, it's not easy. I don't want to stop. I want to do everything that is out there that I could possibly do that I just can't do anymore. So it's still challenging, but I would say that the way that I approach this disease has completely changed.
I love that. Thank you for sharing so much wisdom that you've gained through living most of your entire life with migraine. Thank you for sharing that with us, and thank you for the advocacy work that you do. It's really important, and I really appreciate you sharing your life lessons that have been hard earned. What advice might you give a healthcare professional who's caring for someone living with migraine?
Yes, so I would say listen to your patients. Don't underestimate the power and the impact that that can have on your patients just by you carefully listening to what they're saying, and even the things they're not saying as well. Believe them. Most of the doctors I go to, is always in the back of my mind, please believe me. Please believe me. That is so important for patients to know that they're believed. Partner with your patients. As a healthcare professional, you have limited time with them, but they have time outside where they can learn about the disease. They can connect with advocacy organizations. They can learn, and then they can come to you and partner with you in their care. I would say never give up on your patients. If it is beyond your level of knowledge or your area of training, please reach out to other healthcare professionals or refer the patient out to someone, but please don't ever give up, as it were, on your patients. And the last thing I would say, a phrase that we often use as people who live with migraine, is the importance of having a migraine toolbox. And that may not be a phrase that's as common for a healthcare professional, but the importance to a patient of knowing how to prevent attacks, how to stop attacks, and then most importantly, what happens when they can't stop that attack? What else is there? Because we know, obviously, going to the emergency room is not a great experience for people with migraine. So helping them put together like this overall migraine toolbox so they're able to manage this disease as well as possible is super important.
That's excellent advice. Thank you, Shoshana. Shoshana, what advice do you have for people living with migraine?
I would say, if you're living with migraine, educate yourself about migraine. Unfortunately, there are not a lot of certified headache specialists in the US or even globally. And so while it may seem unfair, it's really important for you to educate yourself as much as possible so you can partner with the healthcare professional that's helping you manage migraine. Advocate for yourself. Don't be afraid to speak up. If you need to change doctors, ask for a referral if you need a referral, or talk to other patients about the doctors that they recommend or the tips and ideas that they have. So important to advocate for yourself. Again, partner with your healthcare professional. It's as you partner with them, you're able to tell them what is working, what is not working, what type of treatment you're willing to use, what types of treatments you may not be willing to use. It shouldn't be so much a parent-child relationship, as a peer-to-peer relationship. Obviously, the healthcare professional is going to know more than you about medicine and the body in general. But when it comes to migraine, you're the one that's living with this. You're living with this disease, and you know how you respond to it as well. Connect with others, super important, knowing that you're not alone. I think back to the days where there was no internet, and we really thought, well, there was no one else who's living like this. No one else who's as sick as me was what I used to think. But there are unfortunately millions of us. And there is a very, very active online patient community across social media and all the different channels. So I encourage you to connect with others. It helps normalize the disease and the things that you're going through. And also helps you learn, because people have tips and things that they can tell you. Or if you have a bad experience, just being able to vent and talk about how you feel can be huge. Extreme self-care, already mentioned that, really important. Having gone through decades where that was not a priority for me, I'm a great example of what can happen if you don't make that a priority. We know that migraine can chronify, it can progress. And so extreme self-care, super important. And lastly, never give up hope. You may think that you have tried everything, and you may have tried everything in all different combinations and different strengths. at different times in your life, but don't ever give up hope, because there is always something else that can be done. And even if there isn't right now, there are things in the pipeline that could really transform your life in the future. So never allow yourself to give up hope is super, super important.
Thank you. That is wonderful advice. Thank you, Shoshana. Shoshana, you've shared your experiences as a mother with migraine, a wife with migraine. What advice do you have for caregivers of someone with migraine, someone who loves someone with migraine? What advice do you have?
Unfortunately, migraine, like any other chronic disease, impacts every member of the family. It's not just the person who is living with migraine. And so that really has a twofold effect. One is that if you live with someone who you love and who lives with migraine, you can make a difference for them. Small things can make a huge difference. Being willing to bring them a drink if they have a severe migraine, being flexible with your plans, pivoting at the last minute, being willing to listen and to learn and believe them as that thing that we just want to be believed. Most people do not use migraine as a reason to get out of doing things. And so it's really important to believe your loved one, how severe their attacks are and the impact it has on their life. Get creative in your relationship. It's hard to not be able to do things the same as other couples may be able to do things, but it's possible to do some amazing things like staying at home and watching a movie, like doing board games, finding other ways to improve your relationship and rediscover your love for each other, I guess, is super important. Focus on what is important. It's not as important to go to a movie theater. I keep coming back to that because a movie theater is often the perfect storm of lights and smells and sound and uncomfortable chairs. But that's not what's important. What is important is growing and deepening your relationship. And then I would say for yourself, it's hard being a caregiver. And I think that most caregivers don't get told that. It's really hard living with someone who is ill all the time or watching someone go through pain all the time. And so take care of yourself as well. Make sure that you have the time to nurture your own person and take care of the things that you need and not always be looking out for the other person. That can be a hard balance to get, but it's really important to do that because you matter as well.
That's excellent advice. Thank you so much, Shoshana. Shoshana, thank you so much for being willing to share your experiences and your wisdom from your journey of life with migraine. This was a really important, interesting session, and I found this so valuable, and I hope that our listeners did as well. Thank you, everyone, for joining us, and thank you again, Shoshana, for sharing your journey.
Thank you. It's been a pleasure.
We hope you enjoyed watching this video and have gained a better understanding of migraine. Please be sure to check out videos on other topics in this series.